What sets us apart from multiple traditional dental offices is that everything happens in-house. So we have an in-house lab, we have denturists that can help us with these procedures, other lab technicians, and get these restorations all fabricated in-house. So that means that you kind of have a quick delivery when it comes to crowns, bridges, or even full mouth reconstruction. So I just want to break down what a full arch kind of looks like for you as a patient. Okay, so day one, we start with a consultation. And if it's something that's good for you and that we can make happen, then we follow through with a digital impression and we take those scans so that we can prepare that with our in-house lab so that we can deliver your dentition on the day of surgery. Day of surgery, patients come in, they're sedated. Typically this is under general anesthesia. The teeth that are remaining are removed, the bone is smoothed down, implants are placed, and teeth are attached after that. So you walk out that day with a new smile. Although those are the temporaries, they're highly aesthetic and functional, and you're under our care for those remaining 4 to 6 months until we get you into your finals.